Aging changes. Dermatochalasis. Involutional changes with redundant upper eyelid skin with folds formation. Microscopically, there is thin epithelium with flat papillae, loss of elastic tissue and collagen, capillary endothelial proliferation, and orbital fat prolapse. Senile ptosis. Levator aponeurosis, disinsertion, stretching, or dehiscence from its normal position. Senile ptosis may be due to involutional changes, frequent eyelid rubbing, or eyelid speculum application during intraocular surgery. There is high lid crease, thinning of eyelid above the tarsus, but with good levator function. Senile entropion. Senile entropion is inward rotation of eyelid margin. The following occurs in senile entropion: horizontal eyelid laxity, vertical eyelid instability, disinsertion of lower eyelid retractors, capsulopalpebral fascia, and inferior tarsal muscle, overriding of preseptal orbicularis, and atrophy of orbital septum and tarsus. Associated tarsal conjunctival chronic non-granulomatous inflammation and fibrosis, increased atrophy of tarsus and orbital septum, epidermalization of the conjunctiva and cornea due to chronic irritation by eyelashes. Senile ectropion is outward rotation of eyelid margin. Microscopically, there is horizontal eyelid laxity, orbicularis oculi ischemia, tarsal hypertrophy, and fragmentation of elastic and collagen tissue. Inflammation. Hordeolum or stye. It is acute infection of eyelash follicles externally or meibomian glands internally. Stye or hordeolum externum. It is an acute suppurative inflammation of this gland by Staphylococcus aureus. There is purulent folliculitis and perifolliculitis, abscess formation, and skin focal necrosis with drainage of the abscess. Chalazion. A chalazion is a focal inflammation of eyelids with chronic lipogranulomatous inflammatory reaction to sebum in tissue. A chalazion may be due to chronic posterior blepharitis or rosacea. Obstructed ductules of meibomian glands result in accumulation and release of sebum in the tarsus and surrounding soft tissue. Degraded fatty acids induce an acute chemical inflammatory reaction with pain and erythema. The role of bacterial agents, Staphylococcus aureus, is still unclear. Microscopically, there is chronic lipogranulomatous inflammation, where epithelioid and giant cells surround empty lipid vacuoles, as fat dissolves in tissue solvents. Fat is seen in unbleached preparation or with fat stain. Chalazion is surrounded by pseudocapsule of compressed tissues. Recurrent chalazion should be examined histopathologically to exclude sebaceous gland carcinoma. One of the following may be the fate of the chalazion: spontaneous resolution, stationary course, rupture at conjunctival surface forming polypoidal granuloma, extensive fibrosis and scarring, fibrotic chalazion, exteriorization as it perforates through the tarsus, or lesions may show acute inflammatory response, acute abscess. Also, the chalazion may undergo margination and is thus called marginal chalazion. Blepharitis. Blepharitis is chronic inflammation of the eyelid margin. The following may predispose to blepharitis: chronic debility, malnutrition and vitamin deficiency, diabetes mellitus, senility, or local causes as seborrhea, dusty hot atmosphere, and uncorrected errors of refraction. There are various types of blepharitis: squamous or seborrheic, ulcerative, angular, parasitic, allergic as that caused by cosmetics, specific, tuberculosis or syphilis. There are various types of blepharitis: squamous or seborrheic, ulcerative, angular, parasitic, allergic as that caused by cosmetics, specific, tuberculosis or syphilis. Microscopic picture. Molluscan bodies, Henderson-Patterson corpuscles, large homogeneous intracytoplasmic eosinophilic poxvirus inclusion bodies, viral DNA, within degenerated epithelial cells. They enlarge and become more eosinophilic towards surface of the epithelium. Marked epithelial acanthosis. Viral warts, Verruca vulgaris, benign hyperplasia of the squamous epithelium of the epidermis caused by human papilloma virus infection. Small papule at eyelid margin with finger-like projections on the surface. Microscopic picture. Massive epidermal acanthosis with papillomatosis, parakeratosis, and orthokeratosis. Cells show cytoplasmic vacuolization, coilocytosis, in granular and squamous cell layer with intranuclear eosinophilic viral inclusion bodies. Parasitic infestation. Myiasis, caused by fly larvae, Dermatobia hominis, and it rarely causes intraocular involvement. Chronic granulomatous inflammation, sarcoidosis, systemic multi-organ chronic non-caseating discrete granulomatous inflammation of possible autoimmune etiology. Pathology, slightly elevated and umbilicated papules, diffuse eyelid affection, partially depigmented in black races, ocular involvement in 38%, skin involvement in 23%. Microscopic picture. Non-caseating epithelioid granulomas. Giant cells may show inclusions. Showman bodies. Refractile small spherical calcified bodies with central lamination. Asteroid bodies, star-shaped inclusions. Birefringent calcium oxalate crystals. Leprosy. Chronic granulomatous infectious disease caused by Mycobacteria lepra bacilli, which are obligate intracellular organisms. Pathology. Ocular involvement. Two types exist: lepromatous or nodular leprosy, and tuberculoid or maculoanesthetic leprosy. Tuberculoid or maculoanesthetic leprosy. Pathology. Erythematous depigmented anesthetic eyelid patches, lag of thalamus, facial nerve involvement with eyelid paralysis, keratitis with corneal ulceration. Microscopic picture. Peripheral nerves show chronic interstitial neuritis with destruction of nerve fibers and fibrous tissue proliferation. Non-caseating epithelioid granulomas with plasma cells and lymphocytes. Lepra cells are large histiocytic cells with abundant, occasionally clear cytoplasm containing clumps of Mycobacteria leprae.